Hey there friends, John Farahmand from Balanced Physical Therapy coming at you with a little bit of an educational video about something called radiculopathy. Not ridiculous, not ridiculousness, radiculopathy. What that word describes is that searing hot, burning pain that sometimes runs down your arm or sometimes the back of your rear end, your thigh, and into your calf and foot that is most often caused when one of those yellow guys, one of those nerve roots, gets irritated, or worse yet, gets actually compressed. I saw a patient last week. It was a female patient in her late 50s who came in with very severe pain, numbness, and what she described as weakness in her left arm and hand. She was having trouble holding things, a little bit of clumsiness in her fingers, buttoning a blouse, doing her hair, etc., etc. And after exam, I determined that she had what's called a C5-6 cervical radiculopathy, or what I termed a compression neuropathy. And here's what I want to describe. The purple area of the spine is known as the cervical spine. The blue part is the thoracic, and the green part is the lumbar, and the orange is the sacral region of the spine. So in this particular patient's case, she had a little bit of weakness, she had some sensory deficits, and she had some reflexive, what we call hyporeflexivity. Her reflexes didn't respond as robustly when he engaged her with the reflex hammer. So what does radiculopathy mean, and how do these little nerve roots actually get irritated? Well, as we age, the morphology or the shape of the sort of what we call the movement segment, the bottom one half of a vertebra on top, the disc, and the top one half of the vertebra on the bottom, so an area that's kind of looks like that, the movement segment, in the different regions of the spine, it starts to deteriorate. And without going into too much detail in clinical jargon, here's what I want to impart to you guys. These little nerve roots, which come out between the vertebra and what we call the neuroforaminal space, they start to become crowded, both from the front by a bulging or migrating disc, which kind of moves like an earlobe might move, back into the side, which conspires to narrow that little space from the front side of the nerve root. And then you have this joint behind the nerve root. It's called the facet joint. And over time, with more and more and more rubbing, what starts to happen is that the surfaces of those facet joints, which in a perfect world look like two surfaces of glass staring at each other, well, they start to look kind of like two heads of cauliflower looking at each other, and you get a little bit of bony overgrowth that starts to conspire to crowd that nerve root from the back. So you get this sort of bulging, deteriorating disc that's migrating toward that axillary nerve root from the front. And then you get a little bit of bony overgrowth, or what we call arthrosis, in the facet joint that starts to move toward that nerve root from the back. And what do you have? You have this situation where the space that nerve root is supposed to come out through gets narrower and narrower and smaller, and tighter and tighter. And then, hey, my arm at first, it feels a little nummy, feels a little strange. And then, oh man, it's burning. And then, man, I'm kind of weak. My hand doesn't feel right. I can't really hold or grip as tightly as I normally do. That, in a very simplified nutshell, is something that we call cervical radiculopathy. And that's one of the ways that it can happen, and that's one of the ways and one of the things that we as doctors of physical therapy are very, very effective at treating in clinic. So if you have that constellation of symptoms or something that remotely sounds similar, we'd love for you to call our clinic, visit us at balancedpt.com, make an appointment today so that we can get you out of those symptoms and get you back to the game of life. Thank you very much.